What is LSD? LSD, which is a psychedelic drug, can affect the function and structure of the brain and promote neuron growth, but it seems to interact with multiple receptors such as serotonin and dopamine. LSD shapes and forms. Number 1. Swallow or held under the tongue. Number 2. LSD is light sensitive in solution but more stable in dosage units. Number 3. LSD can be found on the street in the various forms, such as liquid on sugar cube, thin squares of gelatin, tablets or capsules. Number 4. LSD can be taken through inhalation or injection through vein. Number 5. LSD can be pasted on any part of body that are prone to sweating. What are the clinical uses of LSD? During the early 1950s and 1960s, the study of psychedelic drugs such as psilocybin and LSD, sponsored by the National Institute of Mental Health, has shown positive preliminary results in alleviating anxiety and depression among patients with terminal diagnosis. The other studies by Humphrey Osmond, Betty Eisner, and others examined the possibility that psychedelic therapy could treat alcoholism. LSD has been used as a treatment for cluster headaches, with positive results in some small studies.
Exposure. Since Udally reported that this new psychoactive substance sticker, laced with lysergic acid diethylamide, a potent and mood-changing chemical, is being sold for 600 per piece, NPS paves the way to new drugs that can produce more potent hallucinations than traditional and synthetic drugs. Next, crowded clubs filled with dancing bodies, flashing lights, and loud music might be an ideal place for recreational use of LSD. The drug's ability to enhance sensation could make going to a club seem more fun. Moreover, many dealers spend time in these environments, hoping to entice teens to buy the substances they are selling.
LSD trip experience. During LSD trip, user may experience hallucinogenic effects such as changing shape, brighter color, altered perception of speed, and distortion of time, depth, space, size, and shape.
Amplify moods. If you take acid when you are feeling good, you may feel more relaxed, happy, content, excited, and joyful. But if you take acid while you are upset or angry, you may grow more upset or frustrated during the trip. During an acid trip, these symptoms might appear: increase in blood pressure, temperature, and heart rate, nausea, shakiness, dizziness, and convulsions, blurred vision, and dilated pupil. However, these symptoms should subside completely within 24 hours. Bad trips. An acid trip also could produce intense, overwhelming negative psychological experiences in certain users, especially at high doses of the drug. Symptoms of a so-called bad trip include the following: extreme anxiety and panic, delusions and disorientation, violent or reckless behavior, suicidal thoughts and rapid mood swings, fear of losing personal identity or dying.
Withdrawal symptoms.
LSD users may suffer from acute anxiety or depression after the LSD trip. They may also experience flashbacks, which are known as hallucinogen persisting perception disorder (HPPD). A flashback is when the user experiences a trip after the drug effects have worn off. The flashback will occur suddenly and often without warning. LSD users may also manifest relatively long-lasting psychosis such as schizophrenia or severe depression.
Treatment and management.
For the people who have been addicted, help from the experts is needed. The treatment is available at the hospital, clinic, or National Anti-Drug Agency (NADA). Talk therapy and group counseling will help the consumers in understanding their behaviors and why they continue to use LSD. They should take care of themselves by exercising, eating healthfully, and controlling the stress level. They should surround themselves with supportive people and try to stay away from people who abuse drugs. Find new hobbies and interests that will take your mind off drug use, such as joining a volunteer opportunity.